Let's come back to triglycerides now. I want to talk a little bit about this one. This is one of the other chemistry markers that doctors will measure in the bloodstream. So they'll look at triglycerides. Now one of the problems with measuring triglycerides, and let's just start from the parameter of what's high and what's low. You know, most labs today will report that anything greater than 150 is considered to be high. Now, unfortunately, this lab range is too high. What's happened over the past 20 years is people have become more and more obese, and in America, 70% of the people, of the population is overweight. The triglyceride levels on average have gone up in the population, and so what labs did is they recalculated their ranges, and the ranges just kept getting bigger and wider and bigger and wider. Really, ideally, triglycerides below 75 is what I would advise a person to shoot for, not less than 150. So that's part of it. Look at your when you get your triglyceride levels back, you know, shoot for being under 75. Now, what are triglycerides? Triglycerides are fat that circulate in the bloodstream, meaning a person could eat too much fat. That's why we have this war on fat with that low-fat, high-carb diet. People say that fat causes heart disease, and fat really truly doesn't cause heart disease. That's one of the myths. Fat does not cause heart disease, at least not in the way that you've probably been told. So if we draw us a line over here, fat does not cause heart disease. Fat actually, it depends on the kind of fat that we're talking about, and it's a quantity issue. So there is a type of fat that we absolutely know beyond the shadow of a doubt causes heart disease. Anybody have a guess at what that is? That's trans fatty acids are definitely the type of fat that cause heart disease. Now, anyone know where trans fats actually came from? Like where did they come from? Trans fats are actually vegetable oils that have been chemically had hydrogen forced into them so that they go from a liquid at room temperature to a solid at room temperature. Now, this was introduced the turn of the 1900s. Around 1910 was when we first saw margarine, right, or fake butter introduced, and all the doctors were pushing it, saying how great it was for your heart and how much better it was for you than butter or meats. They were pushing this processed vegetable oil garbage as a substitute for butter. And what ended up happening is heart disease skyrocketed because people were eating this type of fat in mass. That's our history, right? So trans fat causes heart disease. If we're talking about saturated fat, I did an entire story, or I did an entire show on saturated fat. You can go back again in the Pick Dr. Osborne's Brains archives, and you can pull that show up. We don't have time to talk about all the saturated fat tonight, but trans fat does cause heart disease, but regular fat does not, and that includes animal fat. Animal fat does not cause heart disease. Here's the caveat. Animal fat that causes heart disease comes from animals that are sickly. So if you're eating this standard swill that you buy in the grocery store, where the cows are on the meat and the chickens and the birds, they're coming from these mass scale farms where they're all closed quarters and they don't have room to breathe, much less exercise or get sunshine, and they're being fed genetically modified grains that are loaded with pesticides as their staple food so that in a very short period of time they can get very obese, and right before they die we slaughter them and we serve them up to the grocery store's food. That's not healthy meat for anyone. And so that type of animal fat does cause or does contribute to heart disease, but true free-range, true organic, grass-fed meat does not increase your risk of heart disease, and that's where you want to know that difference, because there's a lot of people out there telling you not to eat any meat. And although some people do thrive on a vegetarian diet and do really well on a vegetarian diet, it's not the right diet for a lot of people. And so many people going on the vegetarian diet, they're actually increasing their risk of developing heart disease, because a vegetarian diet can be for some low in vitamin B12 and low in vitamin B6, and those two vitamins, when you're deficient in them, elevates another chemical we could add to this list, but most doctors don't measure it. It's called homocysteine. Now, I've talked about this in the past, and so I'll just mention it here. Homocysteine elevation can occur on a vegetarian diet for many people. Homocysteine increase increases the risk for heart disease. It's an independent risk factor for heart disease and cancer and bone loss. and diabetes. And so you don't want elevations in homocysteine, which again, a vegetarian diet can create for some, not for all. But again, this is why I don't like just generic diets where say everybody gets the same exact diet, because when you give everybody the exact same diet, it's not going to be right for absolutely everybody who's on it, and the vegetarian diet is an example of that. But so also too is a high meat diet. It's also not right for everyone. So again, it works both ways. So we've got, going back here to high triglycerides, we want to keep that number under 75. High triglycerides are elevated as a result of eating trans fat in your diet. So if you eat a lot of trans fat in your diet, you can elevate your triglycerides. You can also elevate your triglycerides if you eat a lot of sugar. And this is part of the problem. So this is one of those myths that high sugar, so increased sugar, dietary sugar, equals an increase in triglycerides. And I'm just abbreviating here. So increased sugar equals increased triglycerides. So if you follow this diet, right, you're actually going to increase your triglycerides as a result of over-consuming carbohydrates. And so going back to somebody mentioned a minute ago, my husband's diabetic and eats, Honey Nut Cheerios with 2% milk because the doctors say 2% milk is better than whole fat milk. And again, it doesn't go back. It's not the milk per se, but it's where the milk comes from. It's what the animal was fed. It's how the animal was taken care of. It's what hormones were added to the feed, what hormones were added to the milk, right? All that matters because the quality of the milk is affected by the diet of the animal and the exercise and the stress levels of the animal, just like the quality of your health is affected by your diet and your stress levels. So don't let anybody tell you any differently. If they are, they're probably trying to sell you something. So don't get your sugar levels too high because that's going to elevate your triglycerides as well. And again, if you had high blood pressure and you have high triglycerides and your doctor says, hey, we need to make a diet change, let's go lots of grain, limit your meat intake, and definitely low fat, by default you're on a high carb diet. That high carb diet raises your triglycerides, which elevates your obesity. Now when you elevate your fat storage, obesity has actually been proven to be an inflammatory disease. So if you're overweight, you're inflamed. That's just simply what we've discovered with science. So this is inflammation. And now if we look at the third thing on the board up here, which is high cholesterol does not, remember I said heart disease is not increased as a result of high cholesterol. And I also said that high cholesterol is not heart disease itself. But what happens with high cholesterol is nothing really in terms of heart disease. There have been a number of studies that have shown that the people that have the highest levels of LDL actually enjoy greater lifespans. They have a higher level of mortality, lower incidence of heart disease, and don't benefit from statins at all. But when you have inflammation in your blood vessels and you have high cholesterol, it's like the inflammation creates the damage. The body uses cholesterol to try to repair and patch the damage. And that's why cholesterol is oftentimes looked as evil, if you will, right? The bad cholesterol, even though in my opinion there's no such thing as bad cholesterol, there is such thing as bad inflammation. And if you have chronic overly high levels of inflammation and you also have high cholesterol, that cholesterol is going to try to put out the fire. And so again, we don't want to blame the cholesterol for doing its job. We want to ask the question, where's the inflammation coming from? Well, you ask that question, you put a lot of people out of work because the inflammation for a lot of people is coming from that high carbohydrate, highly processed, low quality food diet. I mean low quality food, meaning if you're eating feedlot meats, if you're eating feedlot birds, if you're eating genetically modified corn and soy, if you're using vegetable oil because somebody told you somewhere that it was healthy, if you're buying canola oil because somebody somewhere told you it was better than trans fat, these are all things that we know can create systemic inflammation along with excessive sugar intake. And for many of you following me, grain, if you're gluten sensitive, is a major cause of inflammation and from a gluten perspective, but grain can also be a cause of inflammation because it's high in carbohydrates. Many forms of grain are contaminated with molds and mycotoxins. Many forms of grain are triple sprayed with chemicals like glyphosate and other pesticides. And so when you go buy these products and you eat them as staples in your food thinking you're doing right by your heart, you're actually triggering an inflammatory response. And remember that inflammation, one of the things that inflammation does is it sucks up oxygen. It uses up molecular oxygen. And when you use up molecular oxygen, that raises your blood pressure. So when you create inflammation, you actually raise your blood pressure. So going back to the cause, what causes these things is a much more important question to ask than what is the consequence if we have these things for too long, and what do we do to artificially mitigate those symptoms without asking the deeper question of what is driving these processes. It's far more important to answer this question on what's driving those processes than to just pop medication. Hey, and if you missed the earlier part of this series, click right here so you can go back and get caught up. The information there might be critical to helping you on your path to better health. And as always, thanks for tuning in. Make sure you subscribe for updates below. Have a great day.